Hello, my name is Mary Ellen Hatch, and on behalf of the ARN Fellow Task Force, I'm happy to welcome you to introducing ARN's Fellows Program. Our task force members are Patricia Quigley, myself, Tiffany LaCroix, Karen Preston, and Melissa Bellows. Our objectives for today are to summarize ARN's history creating the Fellows Program within the nursing profession, interpret the FARN qualifications, exemplify depth and breadth of the FARN career and its contributions, and showcase available ARN fellow resources. So ARN's history of creating the fellowship program within the nursing profession goes back a few years. The invitation to become a fellow of a professional membership organization is an honor reserved exclusively for the most senior and distinguished professional nurses. We've all heard of these fellow programs. Senior is related to established and enduring career track record. Some of the programs you might be familiar with are the Fellows of the American Academy of Nursing, a Fellow of the American Association of Nurse Practitioners, and another new one is a Fellow of the Association of Nursing Leadership, and of course there are many others. Let's talk about each one of those for a minute. The Fellows in the American Academy of Nursing, or FAAN, was first approved in 1964 to 66 ANA House of Delegates. The American Nurses Association bylaws were amended to call for an Academy of Nursing for the advancement of knowledge, education, and nursing practice. In April of 73, 36 fellows held their first meeting. Today, there are over 2,700 FAANs internationally. In 2006, the Academy established a Washington, D.C. office in keeping with its strategic goals and recognizing the pivotal role of public policy in reforming American health. Objectives for the FAAN are to advance new concepts in nursing and health, identify and explore issues in health, in the professions, and in society as they affect and are affected by nurses and nursing. Examine the dynamics within nursing and interrelationships among the segments within nursing, and examine interaction among nurses as all these affect the development of the nursing profession, and identify and propose resolutions to issues and problems confronting nursing and health, including alternative plans for implementation. Fellows of the American Association of Nurse Practitioners started in 2000, and it's the highest professional designation for any nurse practitioner. The program annually invites colleagues who have made a significant impact on the nurse practitioner profession. FAANP candidates' application must provide evidence of contributions in 4 priority areas: research, clinical practice, education, and policy. Of the more than 110,000 members of the American Association of Nurse Practitioners, only 1%, or about 850 nurse practitioners, have been inducted as FAANPs. Their objectives provide that members are expected to engage with other health leaders outside the academic sphere in transforming American health systems by enhancing the quality of health and nursing, promoting healthy aging and human development across the life continuum, reducing health disparities and inequalities, shaping health behaviors and environments, integrating mental and physical health, strengthening the nursing and health delivery system nationally and internationally. Another example of a fellow program is Fellows of the Association of Nursing Leadership. Like ARN, the initial class was selected in 2019. Criteria are demonstrated by leadership evolution, AONL contributions to the applicant's leadership, contributions and/or innovation in nursing leadership, contributions to AONL, future leadership development and leadership goals contributing to the mission and vision of AONL. AONL's fellow designation, the FAONL, recognizes exemplary nurse leaders who have made significant and sustained contributions to the specialty of nursing leadership and to AONL. FAONLs are committed to shaping the future of nursing leadership through expert leadership practice, mentoring developing leaders, and contributing to AONL at the regional and national levels. Fellows in the Association of Rehabilitation Nurses, or FARN, was originally considered by the ARN Board of Directors in 2010, We discussed whether to develop a fellows program and explored the interest and feasibility. Typically, an association fellows program is developed as a way for highly engaged, distinguished, or advanced practice members to be recognized for their contributions in advancing the role through clinical practice, research, education, or policy. In the first quarter of 2010, surveyed members with minimum of master's degree and 5 years of membership. One survey question told us, some associations offer a fellow designation to recognize members who have made significant contributions to the profession and are participating at an advanced level. Criteria may include areas such as leadership, service, published works, lectures, presentations, credentials earned, etc. If ARN were to offer a fellows program similar to the one described above, and there was a one-time application fee of $200 to $250, would you apply? A total of 474 members responded to this question. 60% answered no, they would not apply. 40% indicated yes, they would apply. This means that 188 nurses indicated interest at that time. Estimates for 1 year projection, 40 applications at $225, and a year 2 projection, 15 applications at $225 of a fellows program with an initial fee of $225 and no renewal fee for that program. This is based on feedback from the original survey in which most respondents indicated they would not expect to pay for renewal fees for fellow status. It was deemed as not profitable and did not move forward at that time. So I'm going to turn it over to Pat Quigley to speak about the second reboot of looking at the ARN Fellows Program.
Thank you so much, Mary Ellen, for that introduction to the work that we're providing for you today, this webinar, colleagues. And Mary Ann, for doing an overview of the existing fellows programs that really do have prominence in the nursing profession, and to showcase the intent to have ARN's fellowship program hold the same level of designation. And Mary Ellen, just on a personal and professional note, while we are together, we'd like to thank you for your extraordinary leadership in launching this program, because you did serve 2 years on the task force to actually launch the program, its criteria, its application process, and selection status. So Mary Ellen, thank you. And as I share with you, colleagues, and we revisit the FARN fellowship program, it is fast-tracked 8 years from the original discussion in 2010, because this board of directors at that time decided that it was time to go ahead and designate this level of a program within the Association of Rehabilitation Nursing. So at the conference in West Palm Beach in 2018, October, the honor to confer this fellowship program and to have the nomination and the acceptance program developed was indeed recognized. So fellow status is the most distinguished level of membership in the organization, and it is a public hallmark, colleagues, of your professional esteem. This is all about you. This is your contribution as a rehabilitation nurse that sets you apart and distinguishes you for your career trajectory and contributions that is outstanding and sustained. So fellowship status is intended to recognize nurses within ARN who have displayed outstanding leadership in rehabilitation nursing, contributions to ARN, and have provided sustained, distinguished contributions, service, commitment to this specialty field. So as you'll see on the next slide, the criteria for becoming a fellow of ARN is absolutely, you are in good standing. We know that already, and it is only for CRRNs. There is evidence that you must submit that shows outstanding contributions to rehabilitation at a national or international level. The contributions that you must show evidence of include participation, leadership in the association, consultation, research, education, practice, administration, advocacy, and/or public service. It is you who will distinguish what your most outstanding contributions are as you prepare your application. And you also have to be able to demonstrate distinguished leadership in ARN and the profession of the specialty of rehabilitation nursing. So this consistent, outstanding performance over time is what has to be demonstrated in the specialty of rehabilitation nursing. So as we interpret the FARN qualifications, yes, you must have and demonstrate significant and sustained impact on the profession through the areas that I had just recently mentioned to you on the prior slide. You must have substantive honors that you can show evidence of in your CV, for example, and the statements that your sponsoring members will go ahead and discuss in their letters. But substantive honors and awards and recognitions and contributions of rehabilitation. And this is not just in your work field, this is from the profession, from the nursing profession. And distinctive contributions that set you apart. What sets you at the mountaintop of the Association of Rehab Nurses and Rehabilitation Nursing in the community that we all share and are so dedicated to? You must have demonstrated willingness and commitment to continue contributions to the profession and to the organization, so that when you become a fellow, you will be engaged and you will be active and you will be sought after to contribute. And you must have a master's level or higher and have been an ARN member for more than 5 years. So on this slide, colleagues, as you look at this slide and also the second slide, you will see the members who have been inducted into the Inaugural 2019 Fellows Program. This is the distinguished group who are launching the program and will take it further, knowing that in 2020 to 2021, we have another group of fellows that will soon to be inducted at our 2020 REACH conference. But this is a distinguished group. And what I'd like you to see is that we have 2 members that are on this slide that are in blue font. We have Ms. Tiffany LaCroix, who is going to be the next chair of the Fellows Task Force, and Ms. Karen Preston, who is going to be the co-chair of the Fellows Task Force. So this program, as you'll see on the next slide, we do have the 15 fellows that were inducted. We have these people who will be those who you will select one member from as you go forward with selecting your co-sponsors to support your application as you consider being reviewed as a fellow candidate. But as you look at these candidates as well, I would like to help you to know that as Mary Ellen and I and Tiffany and Karen came together, we have continued to increase the rigor of the application process and to help with the selection criteria for the Fellows Designation Program. But as we go forward in the next year, that will become the year when we will have the first group of all fellows who will review fellow applications, because now we're building some capacity. So it is my pleasure at this time to be able to turn this presentation over to Ms. Tiffany LaCroix, because Tiffany and Karen are going to showcase their exemplary contributions that made them worthy of selection as a fellow, and also share with you some tips as you prepare your application process. Thank you so much. Tiffany, it's all yours.
Thank you, Pat. So as Pat had indicated, we really want to provide examples and be supportive to others who are looking for this designation in their future. So I just want to say that being inducted as an ARN Fellow is such an honor. This has been an opportunity to really reflect on my career and to really look back on my accomplishments and be able to highlight this in an application. So I really want to encourage and support future members who are considering applying for this distinguished award by sharing this process, including examples of meeting the criteria. So the application, as Pat had indicated, should really reflect both the depth and breadth of involvement and contributions over the time of someone's profession. So most current fellows, for example, have CVs that reflect a career dedicated to rehabilitation nursing. So the application is more than a checkbox. It's truly a story of contributions and dedication to the rehab nursing profession over a period of time. So for example, my application demonstrates 25 years specifically working in rehabilitation nursing. It also demonstrates being involved not only through my job and career, but projects and work groups on a volunteer basis, working with others like myself with a focus on improving the care of the patients we serve in rehabilitation nursing. I'm going to share a little bit of my history and how I got involved and became connected and was provided some opportunities that now have built up quite the CV. So I became a member and was connected relatively early in my career to ARN. I had the benefit of attending annual meetings. I wanted to get more involved. I wanted to contribute to this profession. So while I didn't have a local chapter available to me, I wanted to be a part of improving patient care and driving change for rehabilitation nursing. I work in a freestanding rehab hospital, and it hosts several conferences. I often presented at those conferences, specifically for rehab nursing. And during this time, I also became certified as a rehab nurse. That was important to me. It brought skills to the bedside that I felt like my patients benefited from. I wanted to support and encourage my coworkers and team to also get their certification. I felt like it was such a positive impact in our organization. So we, a few of my coworkers and myself, began to coordinate study course. We wanted to prepare others who were also seeking their certification to prepare them to be successful with this. That course itself actually grew into a 3-day course. This was outside of our work. This was because we wanted to give back to our profession and get others on board. We saw the positive results from it. So this really made me hungry. I wanted to help others achieve their certification because we saw what a difference it made. It was inspiring to all of us that were involved. We knew that there was such potential with growth and that our patients in our rehab setting were really benefiting. After a while, I was able to start attending the ARN annual meetings and consistently been able to attend those over the course of years. At those meetings, I really started connecting and networking with other rehab nurses. It's such a great environment. I began looking for opportunities to get more involved. Anytime ARN had an opportunity for volunteer, I would hold my hand up. I became acquainted with several leaders within the organization and began seeking opportunity to become more connected to this association. Some examples over years of involvement include being involved as either an author or a content reviewer to the specialty practice of rehab nursing, which is our core curriculum. I've also had the opportunity to serve several years on the Continuing Education Provider Committee, also the annual conference planning committee, including 1 year serving as the chair. I also have the opportunity to serve as a faculty for the profession of rehab nursing course, which is also a prep course for certification. That was a great experience. I have for years served as the clinical editor for the collaborative project between Elsevier and ARN to develop the nursing rehabilitation skills collection. I learned much through that process and also became very connected to some of our peers. So while some of these appointments have been for only 1 year, some of these were actually projects that lasted several years and continue. And so that demonstrates involvement over a period of time. Now, at the same time, outside of ARN, I also worked on rehabilitation nursing projects and other groups, including the Brain Injury Model Systems and the American Congress of Rehab Medicine. I presented through these organization nursing topics that were pertinent. Through my involvement with these groups, I've been able to also participate in studies that have been published with an aim that has impacted our nursing practice. So through my career, I've been involved in research to the extent of participation in 15 clinical research trials for both medications and devices specifically used on rehabilitation patients. I've received several awards through presentations and for posters that I've presented at some of these conferences. I've been recognized within my work organization, receiving such awards as Chief Nurse Award, also international awards for the Daisy Champion Award. And all of these have been reflected on my application to show the volunteering spirit. As Pat had indicated, this goes beyond our work and our organization. So yes, I'm a rehab nurse. I work in a rehab organization, but all of these projects were outside of what my work was. These were additional volunteer opportunities to really drive change and improve what we're able to do as a rehab nurse. So when you are selecting your sponsors, you'll need at least one of them to be a fellow. You want to choose your sponsor that can really speak to you, your involvement, your sustained work over the course of your career. While you may not have had the opportunity to work with a fellow, or maybe you don't even know a fellow personally, you can find a list of names on the ARN website, and you are able to reach out to them and request their sponsorship. Of course, they'll need to be supplied with your CV, and you will need to have several conversations ongoing to really develop what is needed and captured for them to sponsor you. The sponsor will be submitting a sponsor statement that includes the capacity in which they have known you, the nature of your relationship, and the length of time you've been associated with them. The sponsor is then asked to also summarize your contributions to the profession and attest to the evidence supporting these qualifications. So as you know, or probably have already viewed the application, I strongly encourage you to get started and look at it early. Likely, you will need lots of time to ensure everything is updated and included on your CV. Your CV will be a part of your application process. You also want to start considering who you might ask for sponsorship. Remember, you only need 2, of which one needs to be a fellow. So don't wait until the last minute. Next, I want to introduce Karen, who will also provide her examples.
Thank you, Tiffany. I have been a member of the Association of Rehab Nurses since 1979. And I was very fortunate to have had 3 good mentors along the way, and they were critical in terms of my development. And so I'm going to talk about some of their stories. But through the years since 1979, I've been working inpatient as a staff nurse and later as a community outreach nurse in spinal cord injury and brain injury. I've spent most of my career out in the community working with home health agencies, a visiting nurse association, and then moving into private case management. So I've had a very different track than a lot of other rehabilitation nurses, and it's a story of a lot of twists and turns. So the first thing I would like to say is that you do have to be open to opportunities. Today's leaders are looking for you. They want other people to do things as well. Leaders don't just want to do things themselves. They're looking for the next generation, the next group of people who will carry on where they leave off. So you just need to position yourself to be where you can be found. And when opportunities arise, recognize them as opportunities and take them. Each activity that I have done along my path, at the time it was offered, I thought, wow, this sounds fun, or, oh, that's easy, yeah, I could do that. Or it was a new experience that I hadn't had before, and I just thought I should try out something new and different. So none of the things along my path have really been what I would consider very hard or daunting or not doable, frankly, by anyone else. I think that we all have the capacity to do this if we're just open to it. So my path started in 1979. The director of education, when I was getting oriented into the spinal cord injury unit, had a philosophy that she, as a single nurse, could not do enough in her career to get rehabilitation as a nursing specialty where it needed to be. So her mission was to train as many rehabilitation nurses as possible, recognizing that they all wouldn't stay at the same employer and would go forth into the world and do their parts to continue creating and evolving rehabilitation nursing. So she had noted that I was taking care of a patient with a C2 spinal cord injury who had phrenic nerve stimulators. And back in the late 70s, this was kind of novel. So she suggested that I do a grand rounds presentation over in the main hospital to just talk about this case. And that went well, and it was kind of fun. And then she said, gosh, you know, there's another hospital here in the community that's getting a rehab program set up. Maybe we could do an in-service over there for them. And then, gosh, after we were done with that, she said, you know, you've done it a couple of times. Why don't you submit it as an abstract for a case study at the ARN conference? And so we did that. And then the journal editor, being a good journal editor, attends all of the sessions and is looking for potential journal articles, and came up to me after the presentation and said, gosh, that's a really interesting case. How about taking the notes that you already have and turning that into a journal article, and we'll help you do that. So you can see that little by little, step by step, people will help you and will give you the coaching and the assistance that you need. You just have to be willing to say yes to those opportunities and be willing to get involved. During that, of course, being a member of ARN, there was also opportunities to get involved in the leadership, both at my chapter as well as nationally. First starting out with working on committees, doing presentations, and then eventually deciding to run for elected office. The thing to remember with this whole process is that there is no finish line. This is something that you do for your whole career. And you can't say yes to everything, at least we shouldn't, I've learned that. But you want to say yes to a lot of things. And so you may do some things at your chapter level for a while, and then you're focusing nationally and less on the chapter, or vice versa, or maybe you are able to do a little bit of each for both, and then you look for things outside of ARN as well where your contributions can be useful. Because I have spent a lot of my career outside of the four walls, outside of acute care settings, I was able to discuss with the Visiting Nurse Association that I was employed by the possibility of creating a clinical nurse specialist position. And they were very supportive of that. You want to get the support of your employers as well. That makes it a whole lot easier. And I was able to create a clinical nurse specialist position. We had 5 visiting nurse offices in a 3-county area, and my job was to travel between them and help train the nurses and do consultation visits on patients at home and provide ideas and coaching to their primary visiting nurse in order to carry the care forward. So it was a way to bring rehabilitation into the community. And then as I got into case management for workers' compensation, there was a professional association for that, and I was able to get involved in that and again introduce a lot more rehabilitation concepts to claims examiners and attorneys, and the whole concept of working as a team for the benefit of the patient. So it's something that is continual. You keep doing, even if it's just little tiny steps. It's not like a giant daunting leap that you have to take off the top of a building. We're just taking little baby steps sometimes. And looking back then over a couple of decades, you say, wow, my goodness, I have really done a lot of things. And that feels good. And then you start to become recognized as being the resource. People come to you and ask you for assistance, ask you to be involved in activities, and that's part of measuring your success as well. To follow up with what Tiffany said, looking at your sponsors, who knows you best? And if you don't know a fellow at this time, find them. We want to find you. Certainly it's a little harder right now being remote. We're not at conferences where we can meet each other, but there's the forum, there's emails where you can reach us. And we're happy to have people reach out to us and pick our brain, have the ability to talk with you about what you're doing and where you want to go in your career. We're here for you. One of the things that I think is really important is when you pick your sponsor is who can speak to your qualities, not just simply reiterate what's on your CV and resume. You would like to have a sponsor who can tell stories too about what your path to leadership has been and how you have had an impact on others and on the field. So you want a storyteller as your sponsor as well. So fellows are meant to be an example to others and to inspire others. So you do want to build relationships with the current fellows, and if you become one, that's part of what you will be expected to do, is to build relationships with other people and encourage them in their leadership journey and possibly becoming fellows as well. One of the things that's really clear as you look at who all the fellows are is that you can be absolutely spectacular in your paid job, and that is not going to be enough to bring you to the level of becoming a fellow. You want to have skills and contributions in the broader community. So think about what your history has been, think about your stories, jot them down if you need to, and even though they may seem like small little stories, as you build a list, you'll see that that it can be really long, but that you can also see if there's areas where you think you would like to fill in some gaps or maybe have more breadth or depth in your storytelling before you file your application. So develop your plan. You may have more history than you know. Sometimes we don't realize the impact that we have had on other people. And that can be a journey just figuring that out, because we want to see that in your application. But I remember a couple of years after my term as president, I was speaking with someone who had just been elected as the new president-elect for the association. And she hadn't been a member of the association terribly long, maybe 10 years at that time. And she said that when I was president, she was sitting in the audience during one of my speeches and heard me say, you know, any of us, any of you sitting there could become president, could have a leadership position within the association. You just have to choose to and say that you want to do that and make that part of your plan. And she said that that really struck her, and that that's why she decided to run for the board of directors and become a director, which she did, and then later ran for president and became president. So you never know what the words that you're saying are that are going to have a big impact and really inspire other people to do things. So that's really made me careful of what I say to people and think about the words that I'm putting out that may influence others. But you want to try and discover what some of that impact has been if you can, because that's part of your storytelling as well. So Pat, this goes back to you.
Well, Karen, thank you so very much. And Tiffany, thank you so very much for sharing your, not just your application process and the tips, but your indeed distinguished career and the trajectory of your career that brought you to be inducted in the inaugural group of ARN Fellows. You have both showcased how you have contributed and shaped the profession over time. And that's the legacy that gets showcased when everyone is selected as a fellow. I think we all share, Marielle and I, Tiffany and Karen, all share with you that the essence of being engaged in the profession. And when we're engaged in the profession, we shape the profession. And when we help shape the profession shapes our practice. And that's the career opportunities that I think Tiffany and Karen, you both have actually demonstrated for everyone who's listening to this webinar. So thank you again so much, because you have helped to showcase how you have sustained and progressed in your contribution to ARN, to the specialty of rehabilitation nursing. And you provided guidance to those who are considering application. So you know what, colleagues, as we share with you, there are available resources for you to help you with the application process. We want you to know that you have so much support. We don't want the application process to deter you, but to help you be able to use that process to showcase your distinct contributions. And the fellows will help you do that as well. Each person, as you go forward, will find one fellow as a sponsor, and then a non-member of ARN, a non-fellow of ARN. So you have two co-sponsors, one who is a fellow and one who is a non-fellow, both members of ARN. And then, of course, there's the task force, which will be transitioning into the fellow selection committee, that we are here to help answer questions as well. And then there's the ARN staff to help support the process, and that is Melissa Bellows, as you saw in the very first slide. So as we conclude this presentation, colleagues, the FARN Fellowship does indeed, on the next slide, indicate a distinguished designation of the highest regard. And in ARN, this is of the highest regard, as you had heard on the prior fellows that Mary Ellen had helped to showcase. So don't let the application process deter you. You know, the fellows, the task force members, and the staff are all here to assist you. So with that, thank you so much for viewing this, this webinar. We hope it's been helpful to you. We offer you so much support, and we are here to help you. So please consider going forward, but appreciate too the trajectory of distinguished career that is demonstrated to be worthy of fellowship designation. Thank you all so very much. Thank you. Thank you for being members of ARN. Thank you very much. This concludes our webinar.